This is the Rethink Podcast, where we talk to people who challenge the status quo and who are reshaping, reigniting, and rethinking the economy through health innovation. Please welcome your host, Sanj Singh.
Thanks for tuning in to this podcast. We call it Rethink of the Office of Health Innovation and Economic Development. For those that are tuning in for the first time or have not heard of the organization, it is a nonprofit charity that was set up in 2019. The OHI, its predecessor, was really the Health Opportunities Committee that existed at the Saskatoon Chamber of Commerce for the last 20 so years and has made some, I would say, very productive contributions to the Saskatoon and Saskatchewan community, particularly in the field of health innovation, and also a lot of the infrastructure with the CLS being here, the Sylvia Fedoruk Center, and other initiatives that the organization has been involved in over the last 20 years. A few years back, we decided to spin out the organization as the mandate became province-wide and also national. And hence the Office of Health Innovation and Economic Development. And you notice that the economic development part has been added to really emphasize that health is an economic engine. And I think this past year, the COVID-19 and pandemic, which I'm sure everyone wants to put into the rearview mirror, has been a perfect demonstration of how health and the health and well-being of citizens can really impact the economy. To an extent, I think even people in the field didn't really recognize could happen. It's something that was completely ambiguous, unpredictable, and we've had to manage our way. So today, we have guests, and in terms of what better guest to have is Volker Gerdts, the director and CEO of VIDO. And for those that don't know VIDO, it's the Vaccine Infectious Disease Organization. It's a longstanding organization here in Saskatchewan and Saskatoon. So welcome, Volker, to the podcast.
Thanks for having me.
Yeah, and joining him is, I would say a former student of mine. I had the pleasure of having Tyler in my MBA class that I taught at the University of Saskatchewan. He was one of the three inaugural Canadian Institute of Health and Research funded grads that had PhDs doing their MBAs. And in my time, that was the best year for me as a prof in teaching these individuals. And I really enjoyed Tyler Whale having in my class. And welcome, Tyler.
Thanks, Sanj. Do I have to say that you are my favorite prof too, or is that just par for the course?
Well, that's just par for the course. I think that's just appreciate that. And Tyler really is the business development strategist and helping the Vice President Paul Hodson at VIDO in developing that. So welcome and to this podcast. You know, the podcast is called Rethink. And I think the COVID has given us an opportunity. I remember a good leadership prof of mine, Ron Edmonds, who said the best thing to change is a crisis. Now, in one case, if crisis doesn't happen, you create it. In this case, we didn't have to create it; it happened, but it really challenged our mindsets. And it's been a real test for humanity over the last 18 months. And I think will continue to be for the next 6 to 8 months and how we move forward. So, you know, the focus of this podcast, really, I heard Volker, he's been on the news quite a bit and promoting VIDO, which I think is phenomenal. I sit on the Biotech Canada Board of Directors, and every time at our board meeting or other committee meetings, the name VIDO comes up, and I'm so glad about that because I'm the only representative on the Biotech Canada board from the prairies. Usually in that field, it's usually Vancouver, Toronto, Ottawa, Montreal, the usual suspects. So Volker, you had mentioned in one of the newscasts and media interviews you did that VIDO wants to become the Canada Centre for Pandemic Research. And when I heard that, I thought, that's, first of all, thanks for thinking bold. Thanks for thinking big. And, I want you to a little bit talk about that and what that means. And then I want to kind of backtrack into what COVID and the pandemic has maybe, let's say, illuminated that path for you and made it possible.
Sure. Thanks, Sanj. So this is really speaking to our vision to become Canada's Centre for Pandemic Research. And what that really means is helping the country, helping Canada to be better prepared for the next emerging disease, whether it's a global pandemic or a emerging disease affecting humans or animals. And I think we all learned during this pandemic that Canada and many other countries in the world was not really well prepared for this pandemic. We weren't ready for it, and we lacked a lot of capacity, both on the research side as well as the manufacturing side. And so this vision for becoming Canada's Centre for Pandemic Research really speaks to being better prepared for the future, having an impact on our business and our local communities, being not dependent on other countries to develop vaccines and manufacture vaccines for us, for Canada to be in the long term self-sufficient, sustainable, and be able to rapidly respond to any new disease. And so you can't have just one center doing it all, but what VIDO will do is we will bridge from early discovery all the way into manufacturing. And so we're adding right now infrastructure that allows us to do exactly that. So we're building additional capacity for early discovery research. We will have some of the world's best researchers working right here in Saskatoon, developing new technologies and allowing us to rapidly respond to any new outbreak, whether it's a human or an animal disease. And then on the other hand, we already operate Canada's largest high containment laboratory, so we're able to safely work with these pathogens. And now we're adding a GMP pilot scale manufacturing facility to it. And what that will allow us is take that discovery research all the way into manufacturing and development. And that will enhance our ability to rapidly respond and help Canada in the long term to have capacity to domestically manufacture vaccines and be self-sufficient as a country.
Yeah, so let me pick up on the infrastructure and the time, and something that our audience probably maybe everybody understands what a cytokine storm is now because they've heard about it. But Tyler, I want to bring you into this discussion on really the investment and the time that is required in infrastructure, in human capital, intellectual capital. Can you touch a little bit on that VIDO just didn't appear, as Volker was saying about being prepared, preparation, what goes into being prepared from an investment standpoint, and also some of the economic spin-offs, because, we're talking about, PhDs and postdocs, and, this is not, $15 minimum wage jobs, and also very specialized talent. So maybe touch on what it takes to be prepared and looking at the economic requirements and investment and time.
Yeah, good question, Sanj. And again, I think it's important to note that VIDO's been around since 1975. So they've been doing veterinary research for a long time, and have obviously, we now recognize the importance of One Health, of plant, environmental health, animal health, and human health, and how they interact. And one question that you asked at the start that maybe we touch on is, did we create the crisis, in the sense that we are interacting with animals and wildlife in broader ways and more ways than we ever have before? And a lot of people probably don't know that many emerging diseases, in fact, I think it's around 70%, come from that animal-human interface. Yeah. But to get to the infrastructure point, Sanj, you're right, that these things don't build themselves overnight. The three pieces of infrastructure that make VIDO particularly unique at this point in time are it's called a BCL3, a biocontainment level 3 laboratory. Volker, why don't you explain what that means, and then I'll go on with the infrastructural things.
Yeah, just briefly, just to give.
So it's a very large high containment lab, and it allows you to safely work with potentially dangerous pathogens. So there is 4 categories of pathogens. Number 1, the lowest would be what you use to make bread, or use in when you brew beer or whatever. So it's harmless. The category 2 pathogens are those that we encounter in our daycare, schools, and so on. So common cold and so on.
Yeah, by the way, I call that the cesspool.
Right. Level 3 pathogens are those that potentially are very dangerous to the individual, either working with it or being infected by it. And then level 4 pathogens are the ones that not only are dangerous to the individual, but also have a huge public impact. So the highest level is level 4. Ebola virus, for example, would be level 4. This is a level 3 facility, so that it allows us to work with COVID-19. And what it is equipped is essentially all the equipment that you need to protect the staff. So they're wearing proper PPE and all those things, and at the same time ensuring that nothing will ever get out of this facility. So it's
it reminds me of Jurassic Park, where you just don't want the T-Rex and raptors to be out of their containment facility. These are the bad actors, and
that's right,
the worst of the kind that can destroy you. Okay,
and like Tyler said, it's in fact the largest facility, the largest high containment lab in Canada, and one of the 3 largest in the world, just to put in the right dimensions here.
Yeah, sure. And your daycare comment, we immunologists call that natural immunization there, Sanj. So not the cesspool, but certainly a lot of natural transmission going on. So the level 3 facility, again, it's enabled to contain large animals, which is also fairly unique. So you can do research on bison or camels or elephants if you needed to, but really primarily the main creatures, from alpacas to bisons to cows to pigs, et cetera. And you can well imagine that that's very important in both the agricultural but also the human transmission fields. So the level 3 facility is one. The manufacturing vertical that Volker mentioned is another. So now you can manufacture in-house, and you can get ready for clinical trials, and you can test vaccines at a larger rate, get what people call a technology readiness level, more prepared for industry to take and scale around the world. And VIDO is currently funded and building. They were funded by the federal government recently to retrofit part of the level 3 into a level 4 containment facility. In 2007, when the process began to build the level 3 facility, I think the investment at the time was in and around 150 million. And Volker, if I'm grossly wrong, then please correct.
Yeah,
but 2007, it took a couple of years of planning. It took 2 or 3 years of construction, major investments going into that infrastructure. After that, about 2012, we're looking at a couple of years to certify the facility and to ramp up the human resources to get used to working in it. Then I think there was an issue that had to be fixed. So some of the HVAC, of course, you do your test drive on your Formula One race car, you find that there might be a problem and go back to the drawing board and fix it up. So that gets us very close. By the time VIDO and the University of Saskatchewan were ramping up their ability to use this facility, then COVID strikes. Wow. And of course, VIDO does a drastic pivot to interact or participate in the solutions or the interventions.
And let me just interject there. If the vision had not been thought about 12, 13 years ago, you wouldn't be able to pivot today. I mean, that's just the reality of science, is that it doesn't happen overnight. There's a lot of investment and preparedness that goes in. Yeah.
And so much of that is actually a result of SARS-1. So former directors Lon Babiuk and Andy Potter recognized the importance of having the infrastructure in Canada to be able to work with these pathogens, right? And so the concept really for the level 3 facility was established right after SARS-1 hit, as part of Canada's efforts to prepare for the next emerging disease. And so it's really due to their foresight that we already have this facility, which now has allowed us, as Tyler said, to rapidly respond to COVID-19 and be, in fact, one of Canada's go-to places for COVID-19 research.
Yeah, I think you've done more than 100 collaborations. Is that right, Volker, over the course of the last nearly 2 years? And Sanj, so to put it into perspective, I think in today's dollars, which also makes sense, let's say you were to build another replica of what VIDO has. It might be around $250 million, again, just a ballpark, probably take 5 to 8 years to construct and be certified and ready to use. And the operating costs, not on an inflationary basis, would be 10 to 15 million a year. And that's what's
the number of employees that are working in the facilities now?
So we currently have about 160 employees ramping up right now. So soon we'll be over 200. And that's both for the whole organization. So both for the high containment laboratory as well as the rest of it. So
easy to say 16 to 20 million in payroll.
Yeah. Our operating budget is about 20 some million per year.
Yeah, that's a significant contribution to the economy, and and I think that's something that, and it's ongoing. It's not that you put it together like a movie project and then you got to dismantle it in a couple of years. It's just continuous. Yeah.
And then this year within the federal budget, but also by, with support from the provincial government. So we're now building this new animal facility, and as Tyler explained, upgrading to level 4. So that's another $66 million investment by both the federal, the provincial, but also the municipal government. And I think this is something, when we talk about communities, that's really recognizing the importance of a facility like this on the local business community and the local community here. So we have lots of private and corporate sponsors that are now coming in and donating towards this vision of becoming Canada's Centre for Pandemic Research.
Tyler, I know you were talking about the investment side. Can you touch a little bit about what you would like to see from one at the national level of collaborators, international level for VIDO, at the provincial level of engagement, and then of course at the municipal level, and of course more of these types of crises are going to be in the future. I think that's just something that is probably becoming a fact, and it will happen. And we need to be in a position to respond for the continuation of our species, because these little microbes really are responsible for sustaining or destroying higher forms of life. Yeah. And I think people have understood that.
Sanj, you have to be careful of how you say this, but the pandemic that we had was a good warning shot. It was a good preparedness. Like Volker said, post SARS, we became prepared, but SARS kind of petered out on its own. It didn't get into this full-fledged global pandemic like COVID did. And I think in the sense, the aftermath of a crisis like this offers a unique opportunity for Canada, for the whole country, to position itself to make progress towards our preparedness, towards protecting our citizens, and to better showcase Canadian innovation on a global scale. So the kinds of investments that are going on at all levels of government, like you mentioned, federal, municipal, provincial, are critical, and the federal government has made some key investments, but money isn't a strategy. And so right now you have to coordinate some of these investments. So VIDO is certainly well positioned to play a key role on Team Canada. And what does that mean? You've got to scan the environment. You've got to constantly be prepared. Like Volker said, years in advance of anything coming out, you have to start envisioning what kind of infrastructure or human resources or whatever requirements we need. You need people to do the research and to do relevant research on high containment pathogens, on low containment pathogens, the whole spectrum. You need the ability for experts across the country, east and west of Canada, north and south, with US, with other researchers around the world, to be sharing ideas and collaborating, coordinating again. And then doing clinical trials is an enormous burden and amount of time. It was really remarkable what happened over COVID, but then there's the manufacturing and the scale up and new technologies like the mRNA vaccines that came out this time. These were not something that developed over the course of COVID. They've been in development for a decade or more. They're just now finding their place in the world. And when you say that we weren't expecting or anticipating, I guess you never expect a cataclysm or a crisis, but I think a lot of people could have predicted that this would happen at some point, much like a volcano will go off at some point. So in the sense that we're awakened now, a lot more as a society, I think we get the impact. So when you ask about what everybody else needs to do, I mean, of course, follow the health recommendations and all that kind of stuff, but inevitably, the Canadian government can only fund so much. They don't usually fund the entirety of an operation, and so we have to do some fundraising ourselves. And when you're looking at it in a team vision, a pan-Canadian, a national facility and a national team, so that Canada has some sovereign comfort level, I suppose, that we can respond quickly and not be put to the back of any line relying on foreign service or access during a time like this. It becomes very important that everybody sees that they do have a role. we can be taxed or we can contribute or whatever the thing is. But when you look at the economic impact, Sanj, and maybe this is something else we can talk about, we're going to be unstable for decades to follow the amount of investment and debt that we have gone into and everybody else around the world as well.
Yeah, and the investment required, and I think this is a question that for our listeners and the groups that we communicate with, how do they engage with VIDO? There's quite a bit of opportunity to spin off other types of things, but maybe touch on the fundraising campaign and how people out there can engage and communicate with you. And if there's emails or links, we can provide them as links into this podcast as well for people to follow up on.
Sure. So we do have a fundraising campaign that's underway and actually has been fairly successful so far already. I'm pleased to say that we raised several $1 million already since beginning of this year. That is coordinated in part with the university's fundraising campaign. So there is, a website. You can go to VIDO's website. You can look at it. There is, in fact, a donate button where people can just very simple, one click, make a donation. But really for the larger investors, for the people who are, like you said, are maybe even interested in some of our IP, some of the technologies that we're developing and so on. I think the best approach is to simply contact me or Paul Hodgson, our Director for Business Development. That information is all available on our website, and we'd be pleased to give you a tour of the facility. We do this quite often now. Twice a week, we're touring local investors through the facility at the moment. It's a fairly simple, very informal, very easy way of doing it. Give me a call and we'll set something up.
Yeah, and we'll make sure that those emails and links are provided in the podcast for the people to follow up on. And that's good. Yeah, Tyler?
Yeah, I was just going to say, if I could add a little bit to that too. Yeah, it's a relatively early stage campaign, like Volker said, with a lot of success so far. And I think one thing that people often think is, my $20 or $100 or whatever you do. I mean, might we do a crowdsourcing campaign? Yes, we might. And anybody can contribute. Every amount helps. In fact, we've had people from Saskatchewan, and I got to give a kudos to the people of Saskatchewan, because with a million plus people in your province, you're really doing a yeoman's job of keeping facilities like this and cutting edge science like this alive. But it goes beyond Saskatchewan. This is a national campaign. It is a national requirement, I suppose. But I was going to say that some individuals have given their SGI rebate checks to VIDO, for example. We've had that happen. And yes, we're looking for large and small donors. And another way that you can help is if you have any networks to some of those families of means or organizations of means that want to get involved in something like this and have seen the pandemic as a bit of a disaster for them as well, or maybe even some companies who've made a lot of money over the course of the pandemic but want to give back because societally this has been a disaster. So can we be better prepared, even more responsive, and maybe even prophylactic at preventing these kinds of things in the future? That's the vision. That's really important, and I think we're uniquely all tied together in this one. Nobody has been really immune to the impacts of COVID over the course of this globally.
Yeah, it has been an interesting experiment and test for all of us. Volker, your employees, can you talk a little bit about their commitment? As Tyler was talking about yeoman's jobs. I think about those who are, working away. We see the same file footage on the news media, but you said 150, 200 employees that have dedicated themselves to really helping humankind and the world here. So can you touch a little bit about how they're doing, what they're feeling, and just to give us a sense of what's kind of happening behind the scenes and beyond the backstage?
Yeah, so I'm very happy to say that VIDO probably has one of the best teams in place. We have highly dedicated individuals here who really have volunteered last year almost every weekend, long days, night shifts, and so on. Many of them haven't had holidays for a very long time now. They really stopped everything else they were doing at the time, switched over to COVID, and have not only worked on our own vaccine, which, as you know, is now in clinical trials, but as Tyler said early on, we've worked now with over 100 companies, half of them Canadian, half of them international, on their technologies, helping them to develop their technologies. And so it's our researchers that are giving their time and their commitment to making this possible. And so again, without a dedicated staff like we have right now, we wouldn't have been able to do all of this. And that's really, I think, what sets VIDO apart from many other facilities in the world, in that we have a dedicated group of researchers who's, when it's needed, is willing to step up and really make the difference.
Sorry.
It's all being part of Team Canada, as Tyler said. It's not only working with other institutions, but you also have to have the dedicated staff in-house that is willing to put in the extra effort when needed.
The United Nations that I know you have at VIDO, what attracts them to the organization in Saskatoon? And they're coming from all over the world and bringing that intellectual capital, their cultures, their families to Saskatoon.
Yeah, so we currently have more than 25 countries represented, and that's really what, again, makes VIDO so unique. We have all these international backgrounds here. We have postdocs coming from all parts of the world, from Europe, from Asia, from South America, from Africa, like all over the world, right? And so that makes it a really, really nice mixing pot here, a team environment, a culture that, exposes you to things that normally you aren't exposed to. And so those individuals and bringing their families, and as you said, many of us then eventually settle. I came for 2 years and I've been now here for over 20 years. And that's all part of being part of VIDO's success, or maybe even the reason for VIDO's success. We have this a very unique team environment here. We operate almost like a company, but then at the same time, we're part of the university. We have this team approach, and it's not so much about you and your science. It's really how can we all work together to benefit the world, humanity, and so that's really, I think, what drives us, and it's the passion that we have in these individuals that are working here.
Yeah, I think it's a hidden gem in the prairies. What are you looking for in collaborations, and what type of collaborations? If you can touch or give some examples on, you mentioned these 100 collaborations with companies and working on their technologies. If you kind of put out a call to action out there and saying, hey, collaborators, come and talk to us about leveraging our intellectual capital, our infrastructure, our human resources, our know-how, or even our reputation, and even your networks that you have globally, because everything kind of works in an ecosystem. So what would that look like, and what type of collaborations do you envision?
Yeah, so I think in this pandemic, we have learned or relearned, if you want, that, if you want to be successful, you can't be working by yourself in isolation. Research, global research, diseases are global. All of that has to happen in partnerships with other organizations, whether it's other research organizations, whether it's companies, whether it's individual researchers. And so really, VIDO does a lot of collaborator for contract research with organizations around the world. As I mentioned, over 100 just on COVID-19 research. But then, let's not forget, we do a lot of other research as well, in which we work with companies or research groups, foundations like the Gates Foundation, global groups like the WHO and so on. And so these can all take place in any shape or form if you want. So it could start from a simple contract research. A company can come to VIDO, use our expertise, use our facility to develop or test their technology. In fact, most of the Canadian vaccines that are currently in development all have been tested here at VIDO as part of the regulatory requirements. It can be a true collaboration, so two partners coming together and working on a new innovative idea and showing proof of principle. It can be an academic collaboration where you have researchers in Australia who have a really nice technology that's synergistically works with the technology we have here, and so the two groups coming together and developing more innovative technologies. So it's really at any scenario, any business model you can imagine, how we interact with other groups. And I think, again, that's if you want to be successful in the future, you have to be globally active, and you have to be open and seeking out collaborations with those that are the most innovators or the greatest innovators in the world.
Yeah, and Tyler, maybe this is the place where people reach out and just have an exploratory conversation to learn about the full capabilities, and sometimes even in the discussions, right? You kind of uncover things that perhaps weren't evident or obvious. Yeah.
Sanj, I'm having many local conversations that are a little bit ignorant to the opportunity, I think, that exists at VIDO. So as Volker describes, the many international collaborations and partnerships that they've embarked on, and certainly several local ones as well, I think part of my job is to let the Canadian academic ecosystem know that there is a tool here. It is equally accessible to any university, any academic that wants to do research there, as it is to somebody in Saskatchewan. So first, that's very important. And secondly, like Volker said, there's this need to be scoping global. It's a big and difficult job. You have to get out there. You have to brand and market what you've got. But similarly, there are major opportunities that are at this point untapped, but at the same time, this is a unique point in history where VIDO now has a collection of assets that truly makes it stand out. And we are post-pandemic. Like I said, the aftermath of a crisis, or like you said, is always a great time to build and to rethink how the systems work. So it is a unique point in time for sure. And yes, indeed, these are the times to reach out and have that conversation. And might we enable another university, for example, to recruit the next scientist that's going to work on high containment pathogens with facilities that they don't have? Well, now they do. They know that they now have access to these kinds of things because Canada has built them.
Yeah, I would imagine for a scientist who's dedicated their life to that, it would be like a kid in a candy store to have the capabilities, not only at VIDO, but then also the adjacent infrastructure that exists at the University of Saskatchewan, right? So, and I'm sure you guys have collaborations there. Some of the goals, Volker, that you have for the organization, let's say for the next year, and maybe a little bit beyond, other, as of course moving towards the Canada Centre for Pandemic Research. What are some of the goals that you like to share, and also, how the community and the community that this will reach out to can also help you, in reaching those goals?
Yeah, so one of our goals for sure is to build the center to the level where we have international recognition and are able to rapidly respond to any new disease. So what that really means is that we need to have not only a high containment lab, as Tyler described, but also have our manufacturing facility up and running, and then also have this new animal facility that we're building right now to be able to work with these animals from which we often see diseases emerge. So goal number one is really to establish it, get it all up and running. But then really the big goal is for VIDO to be part of Team Canada, which is Canada's strategy for innovation and manufacturing to play a key role in providing the necessary research capacity, but also manufacturing capacity to be ready for the next disease. So, during peace times, if you want, when we don't have a disease around, VIDO will continue to do what it's doing best, and that's the discovery research, new technologies, new innovations, new products, all these things. But when we then see the next disease happening again, it's our job to be even faster than we were this time and rapidly respond. And so the goal is really to be part of Canada's response to these emerging diseases, be integrated into Canada's strategy for innovation and manufacturing.
Yeah, almost heard Volker there, almost like a preemptive strategy on and anticipating.
I think we're at the stage now where we should be able to predict what the next disease might look like and make a vaccine for it today rather than waiting for the disease to break out and then trying to catch up. And that's been, we're down from 10 years to now, maybe a year to 2 years for vaccine development, but that still results in millions of deaths and trillions of dollars in economic losses. What VIDO is now working on and really pushing the envelope there is to make vaccines today for the pathogens of the future. And science is there to allow us to predict what some of these diseases might be, what the pathogens might look like. And so it's although costly to develop vaccines today that may not be used, in the long term, I think it's a much more cost-effective way if you have these vaccines stockpiled and ready to go for a disease X rather than trying to catch up with it after the disease has broken out. And so that's where our science is going. That's where much of our research efforts are focused on right now.
That sounds terrific, yeah.
Prophylaxis and preventive. I just keep on thinking of the metaphor of a lifeguard. You don't wait till somebody starts drowning to rescue them or treat them. You try to identify the things that are going to get themselves in trouble and pull them out of the water ahead of time. So absolutely, that has to be the strategy for diseases. Viruses can evolve a lot faster than we can pivot, but we do have the science and the brains and the capability of developing technologies that conceivably in the future, a COVID-like pandemic could emerge, and we could be responding in months or weeks rather than years. And like Volker said, look at the economy, the trillions of dollars, the 1.2 trillion in expected debt that Canada is going to be in, the 30% of people that the workforce is unemployed right now. These are the things that affect your healthy community strategy when people aren't able to think about anything else but what am I going to do for putting food on the table or to keep my house mortgaged.
Yeah, and it really does wreak havoc on I would say high-risk populations, so the marginalized populations, and also on women who are usually the caregivers, and it's quite taxing. The 4 Ps of the model of healthcare, right? Which I hear right now, it's predictive, preventative, personalized, and participatory. So you have the predictive. So I almost imagine that AI is going to play a role somehow in this as well. So data analytics, which I think we have one of the top guys in that field, Nate Osgood at the university. Yeah. When I first met Nate, I said, "You're not from around here." He said, "No, I'm from Boston," and an MIT grad, and pleased to have him here. A brilliant mind in health epidemiology and so forth. This is any last thoughts, Tyler and Volker, before we end the podcast?
If people are contemplating Saskatchewan, it is a gorgeous place to live. Like Volker, I signed up for 2 years and stayed for 10. And it's an easy family to come back to, if you will, and pleased to be part of this new effort, I suppose, this new business development campaign. I think one thing that is, I'll credit Jason Field, the director, the CEO of Life Science Ontario, with this saying. He said one of the last symptoms of COVID, and potentially one of the most dangerous, is going to be amnesia. And that will be to forget about what happened when we go back to life as usual and think that this won't happen for another 100 years. There are no guarantees. In fact, I think we need more than ever to be more prepared. And the last thing, Sanj, if there's an action item, like I said before, and just to reemphasize, if you have networks that can help, whether it's with funding, whether it's with collaborative contacts in industry or academia, whether that's Canadian or international, then we are very open to that kind of communication and that guidance, and certainly watch for more news about VIDO and the emerging campaigns that we have to build this concept of Team Canada for pandemic preparedness. I think it's a great one, and we need to do it.
Yeah. Volker, last words to you.
Yeah, for me, it's really this vision, that what the podcast was all about, becoming Canada's Centre for Pandemic Research. I think here at the university, we have a fantastic environment, other organizations, other colleges that are world-class, and it's it's really all about the future, right? And so this is where I'm so excited about, the investment that we have now received will allow us to make this one of the world's leading places right here in Saskatoon. And the impact it will have on local and national communities is going to be tremendous. And I'm really, really excited about that.
Yeah. So, for me, this has been a great pleasure hosting this particular episode. Volker, appreciate your time. I know you're a busy man. And to give you this platform to share that vision, I think it's a fantastic vision. I think that this pandemic research center not only is good for Canada, but for the world. And Tyler, again, thanks for taking the time. It's good to reconnect with you. And all things start with one step. And I think you've taken a lot of those steps over the last 18 months. And we look forward to the next ones, and we're here to help as much as we can to get the word out. So thank you again, gentlemen, and good luck with everything. And we'll sure to keep in touch.
Sanj, we really appreciate the opportunity and the platform. It's a great way to get the word out there, and the work you're doing is amazing. And Volker's leadership by example has been inspirational. No rest for the wicked, but we've got a lot to do, and we'll keep working.